Once again, I welcome you to our health program. I'm called Dr. Peter Nuwagira. I'm a pharmacist with Pecos Pharmacy in Mbarara and a lecturer at the University of Mbarara. And I'm glad to always be approached to talk to us on matters concerning drug safety, matters concerning healthcare, and the best way that our patients can actually utilize pharmacy services. So today we want to continue with the drug safety series. Particularly want to talk about drug interactions. Drug interactions. We're always talking about drugs because when we get sick, we always use drugs for treatment. So it is a very important area in healthcare to always focus on drugs so that we help our patients. So today, drug interactions. We want to look at what can go wrong when drugs are used with other drugs or with other foods that we take during the time we are being treated. So we know that drugs help us to live longer because they are able to treat the conditions, the disease conditions, and they help us to get back to our health. They also reduce symptoms, okay, for the chronic illnesses. We are able to reduce symptoms and live long enough. They also help to, of course, reduce disease progression and transmission, okay? Remember when COVID was being managed, one of the reasons was to prevent transmission, okay? I mean, even in dire pandemics, okay, like maybe Ebola, we know that the chances of death are high, but with treatment, the chances of transmission become low. So all those are benefits of drug treatment, but we know that there are many things that come during drug treatment, and one of them is drug interactions. Drug interactions complicate treatment. They make drugs not as effective, or they bring other effects that we would not have loved during treatment. So that is our discussion today. So what are drug interactions? Drug interactions it's a reaction of two or more drugs, okay, or between a drug and a food. It could be a drink, it could be, these beverages. For some of you who love energy drinks, they are one of the sources of drug interactions when they are taken with drugs, okay? Or it could be supplements, our food supplements that we take. So that interaction between two drugs, or between a drug and a food, a drug and a beverage, a drug and a food supplement, is able to alter the effect of the drug on the body, okay, on the patient. So a drug interaction is when two drugs, a reaction between two drugs that has an effect, okay, on the patient by changing the medication, the effect of the medication on the patient, okay? Usually this causes the medication to be less potent, less effective as it should, or it can result in side effects, the negative effects that we would not want drugs to cause. And when that happens, there is reduced adherence. Patients tend to refuse drugs because of those effects, and we get a problem with management of the patients, okay? So also we know that drug interactions can involve disease conditions. A drug can interact with a disease condition. For example, we know that many nasal decongestant, sprays, okay, they can have a problem when you have high blood pressure, okay? Yes, they can interact with the disease, which is high blood pressure. So it is important for us to, every time we are taking drugs, look at the potential for interaction. And we're going to see the factors that actually contribute to drug interactions. So statistically, drug interactions occur in our population. That's the truth. In a recent study, but in the United States, we see that in the last 30 days, at least more than 50% of the population accessed drugs, okay? And here in Uganda and much of Africa, we know that it is more or less the same, statistics. Most of us, within a month, it could be you, it could be, in your family, there is someone. So the chances that 50% in that home have used drugs in the last 30 days is high. So, and because of that, we usually take more than one drug. So the chances for interaction increase, okay? Actually, the statistic shows that in the US, it was the mean number of drugs used by particular patient were 6.1. I know in Africa it is less, it could be less than that, because many of us do not even afford to buy these drugs. Okay, it could be less, but the potential for drug interaction is almost similar. And we know that for drug interactions, not all of course are so bad, but the majority, about 70% of drug interactions are harmful. Okay, we are going to see that actually some are beneficial. Okay, they are beneficial in medical treatment, but the majority are harmful, and that is why we must be careful. So in terms of the nature of interactions, you can, when you take 2 drugs or even more, or if you take a drug with the food, a drug with a drink, the interaction can be immediate, or it can come after 24 hours. It would be delayed, okay? And that has a bearing on patient management. Because if the drug is so fast, if the interaction is so fast, then you're able to change the drug before it can cause, it can bring many other toxic effects. So that is by the nature of the interactions. The most frequent, of course, harmful interactions we know in medical treatment are especially to deal with critical ill patients. Patients in ICU. When there are drug interactions, then it is more critical, okay? It is more critical than most of the ambulatory or, these patients that walk in, take drugs, okay? And of course, like I said, we also have some beneficial, drug interactions. But we need to be aware that even some of these beneficial drug interactions can have undesirable effects in the critically ill. So it could be beneficial to a stable patient and very dangerous to a critically ill patient. And that's one of those things that we must take in consideration. So we always want physicians, pharmacists, before drugs are dispensed, to be able to screen through for the potential or the likelihood of drug interactions. And here the interactions can affect, how the drug is used up by the body, okay, or how what the drug does to the body also. So it could be pharmacokinetic, okay. I mean, it can affect the absorption of the drug. The interaction can also come from the metabolism of the drug, can come from the way it is distributed in the body, okay, and even how it is excreted. So if you change, and for example, the excretion mechanism or the way the drug is supposed to get out of the body, if another drug is able to change the way the other is able to get out of the body, then it will bring interaction. Because it means that if the drug is supposed to be excreted, taken out of the body in 8 hours, but because you have another drug which delays that excretion, making it 12 hours or 18 hours, it is going to have the toxicity, it is going to increase the toxicity of the other drug. So drugs affect each other during the different processes in the way they work in our bodies. So it could be pharmacokinetic, okay, or what the body does to the drug, absorbing it, metabolizing it, distributing it, and excreting it. Or it would actually be pharmacodynamic, or what the drug does to the body. So we know that, for example, we talked about drugs that if you give it with the nasal decongestants, if you give them with in a patient that has hypertension, okay, then the condition becomes worse. Okay, so the drug is able to interact with the body in the sense that the blood pressures, okay, in this patient are quite increased. So there are many things that factors that bring about drug interactions. There are quite a number. But to start with, the factors that can affect the occurrence and the severity of the drug interaction. One is the number of prescribed drugs. The more the drugs, the higher the potential to interact with each other. And that interaction may be harmful. Like we said, majority of the interactions are harmful. So we must give drugs that do not interact with each other. Or if that interaction must occur, then it should be beneficial to the patient. So the pharmacists, the physicians, it is our role to screen out the drugs that we must give these patients and prevent harmful drug interactions. The other factor that can bring occurrence of drug interactions is the treatment duration. The longer the treatment with the drug, the longer the drug is going to be used in the patient's body, then the higher the chances of interaction. Okay, because it is able to engage the different systems, and it must also come out safely from the body. So the longer the duration, the more the drugs that we give, the higher the potential for drug interactions. The other one is the patient's age. The interactions that occur in children that would not normally occur in adults. Okay, because in children maybe some of the systems are not as developed, as grown. Especially if you look at the enzyme systems. Enzymes help us to metabolize foods and drugs, okay, so that the body gets what is beneficial to it and what is not beneficial, what should be toxic, is taken out. But in children, some of those enzyme systems are not as developed. The same applies to the elderly. When they are very elderly, some of the systems, organ functioning, have deteriorated. So the chances for interactions become higher. And there are also those that, of course, are higher in normal adults than in the children and the adults. So patient's age, disease stage, like I talked about just a few minutes ago, that the critically ill patients, because of the severity of the condition at that stage, there is going to be higher chances of harmful drug interactions. In other words, you could have given the drug and it is safe when he was a stable patient, but now that he's critical and he's on oxygen, okay, he's using intravenous fluids, okay, maybe he's having aided nutrition where they are having NG tubes. I mean, the chances for interactions become higher. So the disease stage is very, very vital. Then the number of prescribers. Because we've seen in practice that the more patients go to different prescribers, the higher the chances that they will experience drug interactions, because many patients do not declare all the drugs that they are taking or the kind of diet that they are on, such that we know that this diet is not for this particular treatment. There are people, for example, that are so much on fruits, but already they are experiencing, just got a patient and he had diarrhea, a lot of diarrhea. Of course, he had gastroenteritis, which was managed. But because he was on simple grape juice, he was taking so many fruits, and we know that this orange juice is able to cause increased peristaltic movements. The diarrhea went on until we are able to discuss his diet and stop some of the food that he was taking during that time of treatment. So the more the patients maintain loyal healthcare providers, the better for them. Okay, so it's always good to see the patient and get the necessary history and the necessary a lifestyle that he's taking or that he's having, such that we know that it can get into a potential for drug interactions. Classes of drug interactions. Like we said, drugs can interact with each other. You can have a drug-drug interaction when two or more drugs react with each other, and then you're able to experience side effects. I mean, we know that when you give, for example, cough suppressants, most of the cough suppressants have ingredients that have sedative effects. They cause drowsiness. Talk about codeine, Pyritex with codeine. Talk about Benylin for flu. There is some codeine that will make someone drowsy. Okay, of course it is good because it stops the cough reflex. Okay, it's able to prevent that irritation or cough, but we know that it makes someone get sedated. So we tell you don't drive during treatment of such drugs. Those are two drugs interacting, because you're able to, if for example you have antihistamines, okay, allergy, these treatments for allergy, and you're also taking the cough suppressants, most of them will interact and we are going to have a sedated patient. So that is one classic example. There are many others. Actually, almost so many drugs there's a lot of potential for interaction. So you need to know what drug you're taking, and then the pharmacist or a physician is able to tell you if you must stop one while you're under treatment of the other. There are drug-food interactions. There are some diets that actually interact with drugs. Okay, we know the most usual one, alcohol. Alcohol will always interact with many drugs. For example, if you are an alcoholic and you get a stomach upset, and then you run to use metronidazole, you're most likely to get a bigger effect. You'll get weak. It can even go into a coma if there is a lot of alcohol intoxication. So alcohol, and I mean we take many beverages that have alcoholic content in them. So it's important to know if this drug, I'm happy that many times patients call us at Pecos Pharmacy asking, should I take my ARVs with this drink? Should I take my asthma drugs with this drink? And we're going to find that some of those drinks, you would rather take them when you're not on treatment, because otherwise the potential for interaction increases. We know that there are many beverages, energy drinks that are contaminated, not really adulterated with Viagra, okay, or these libido enhancers, and they have an effect on blood pressure. Okay, they will reduce blood pressure. So if you're on them and you're hypertensive, then it's important for the pharmacist to advise you accordingly on how to go about it. So those are some of the factors, and those are some of the different interactions. So we have drug food, and drug condition. A drug condition where an existing medical condition makes certain drugs potentially harmful. It makes them potentially harmful. If you have high blood pressure and you're experiencing an unwanted reaction, okay, by a nasal decongestant that you have been given, then that is the problem, is that you were hypertensive. Results of drug interactions. What are some of the consequences? One, it makes the drugs less effective. So that is why we should be aware and take precaution. They cause unexpected side effects, okay, and they may increase action of a particular drug. And if it is undesirable, then you're increasing toxicities in this patient. We also know that there are some beneficial drug interactions. There are many also. So it's important to, it's a case-by-case basis, depending on the condition. For example, we know that in ART, antiretroviral, the drug that we use for HIV/AIDS, there are some combinations, and some of the combinations are because the interaction between those two drugs is beneficial to the patient. So, for example, Ropinava, and Ritonava, they are usually combined. That combination makes Ropinava, of course, is able to reduce, to inhibit the enzyme that makes copies of HIV cells. So it reduces the enzyme. Then Ritonava is able to increase the duration, the half-life of Lopinava, so that it can keep reducing, the enzyme that makes, or inhibiting the enzyme that makes HIV cells. So those interactions are beneficial, and in science, we combine them conveniently for the patient. We also know that there are some foods that help with the other drugs. I know many herbal, for example, herbal medications, okay, that they tell you use black pepper when you're taking this drug, because black pepper is able to enhance the absorption of some of these herbs. Okay, is able to, some herbs they put them in food or in drinks to make the drink easily absorbed, or the herb in that drink easily absorbed. So there are a number of beneficial, but like I said, most of them are harmful. Most of the drug interactions are harmful, and that is why we need to be very cautious. So before taking medicines, we need to tell our healthcare provider about the prescription and non-prescription medicines, including supplements, including herbs, including if you have a special diet your own, you need to let people know. For example, you know that people that are taking warfarin, okay, they are treating blood clots. If you're taking warfarin, we don't expect you to take a lot of dodo, because warfarin is a blood thinner. It makes it reduces the potential for clot, so it makes the blood more fluid. And we know that dodo and some of those those green vegetables, they increase also the thinning of blood. So it makes it, and when you're doing blood thinning, you're supposed to do it in some limits. So even when they are giving warfarin, they keep checking, okay, how the clot is getting is resolving, okay. So if you then add dodo, it will go beyond a certain limit, which is not good. So whatever drug that you're taking, look out for drug interactions. I know many of us don't. Many of us don't. So read the label, okay, those drug inserts. Whenever you purchase a drug from the pharmacy, there is that paper that is inside the pack. Read it. It will have it will show you what are the active ingredients. It will show you the purpose for why you're taking this drug. If the purpose why you're taking this drug was not talked to you, it was not told to you, or if you think you're taking it for malaria, but you see among the purposes or the indications malaria is not there, you should ask, so that they explain why, what other purposes are there but may not be on the leaflet. Directions of use, how you should use it, okay. Other information could mean some dietary restrictions, or what allergies can happen with these the drugs that you're taking. If you're taking some amoxicillin, the other day we got a case of someone who took amoxicillin for a dry throat, a sore throat, and he got hypersensitive skin, okay, rashes all over. And so he thought, how Africans, we go and think that it is witchcraft, but it's not witchcraft. It's the drug that you're taking. They have that potential. So look out for some of the side effects that some drugs can give and be ready for them. Some are tolerable, you can tolerate them, but others may not be tolerable. Then look at the warnings. There is always in that leaflet, there is a warning section. They can warn you on when to talk to your doctor or the pharmacist, okay, during treatment, if you experience certain effects of the drug, the medical condition that may make the drug less effective, okay. For example, you may come for hypertensive treatment, but they say that if you have diabetes, then this drug should not be taken. So you need to be aware. Under what circumstances can the drug not be used? Okay, all that information is there. When to stop taking the drug. So all those are there, and they are there to safeguard us from harmful drug interactions. Okay, so before taking the drug, ask your doctor, the pharmacist, can I take it with other drugs? Okay, and if you have other drugs, declare them so that we know if they are safe or they are not safe. Should I avoid certain foods? Okay, that's another question you should ask your pharmacist. Should I avoid certain beverages or drinks? What possible drug interaction signs should I know about? If I'm taking both of these drugs, if this happens, what should I do? That is one other question. Is there more information available about the drug or my condition? Okay, beyond what is available, maybe in the leaflet, then the pharmacist is able to help you, with that information. So all that sums up on what drug interactions are, the different types of drug interactions, the factors that cause drug interactions, both in occurrence and severity, who is at risk, okay, in these drug interactions. What are some of the types of drug interactions? What are some of the beneficial drug interactions that we're talking about, okay, and what should we do to prevent drug interactions? And with that, I want to thank you so much for your listenership, and I thank you, and I pray that you have been helped in understanding what drug interactions are and how we can manage them. Thank you so much.
You're watching A Youth TV, empowering you.